Is that what she meant, that they wanted to inject you?
Yeah, with Dexapol and months.
Why?
I don't know, because I've never been interviewed, so I don't know. And that's why I'm trying to get my medical reports.
So what happened next?
My niece had to come from her home and prevent them, had a meeting with Dr. Tanner to stop the injection.
Right, okay.
And they agreed that I could take the medication and that I had to start it at that night.
Okay, thank you very much. So that was your first experience.
That was my first experience on medication.
Yeah. Okay. And at that point, were you told why you had to take it?
No.
Were you diagnosed with any mental illness?
No. I wasn't told a thing. I was met with a wall of silence. I spoke to a few of the nurses that I spoke to. If I asked this one particular nurse, Tina, I said, what's your opinion on me being in here? Do you think that I have got... She says, Mary, you're as normal as me.
So Mary, have you actually been formally, by a psychiatrist or doctor, diagnosed as having any sort of a complaint, and then based on that diagnosis being given any prescription for that?
No.
You haven't?
No.
So on the medications that you were given, although not prescribed, did you have any side effects?
I did, yes. I was extremely uncomfortable. When I started to take them, I tried the best that I could to try and induce sickness on a night time. But obviously, after 3 days, some of it was going down, and then it got whereas my throat was closing up and I couldn't get them back up. Also, one of the doctors was watching me when they gave me it because I was going to the toilet after I took it.
Were there any other side effects of the medications?
Yes, there were. I felt as if my flesh was leaving my bones, and I was in terrible pain physically in my body, and I had to get help on the Saturday night at 10 o'clock. They called an emergency doctor. A Dr. Dunn came down, and she was about 7 months pregnant. And I said, please, that she prescribed side effect medication for me. I said, please doctor, can you take me off the medication the hospital put me on, because that is why I'm feeling like I'm feeling. And she said, no, you have to see your consultant on Monday.
So tell me, Mary, when Mr. Paul Shaw from the locality mental health team, which is at 100 Shepherdess Walk, London, when he arrived, what did he do?
He came, he took me into a room and interviewed me for about an hour.
Right. And what type of questions did he ask you?
All personal.
Such as?
Had I been married? Had I been married through marriage, through divorce, through whatever? Or personal questions, just personal questions. Everything that was personal.
Right. So did he ask you any medical questions?
No.
Did he ask you about any sort of mental health issues?
No. To tell you the truth, I was drugged up as well, really, and I was sort of upset at that particular meeting. But so I'm not as compos mentis as I was when I wasn't drugged. But I just remember being upset and being asked personal questions.
What happened after the meeting?
He went out. We both went out of the room. He went into where all the staff were. Everybody seemed to have disappeared, and then a nurse came with a paper in her hand, Jackie, and said to me, "You're now a voluntary patient." And I said, "What does that mean?" She said, "Well, you're free to go or stay if you wish." And I left the hospital within 2 minutes.
Right. And were you given any explanation as to why that happened?
No, I wasn't. Just except that I was free to go. And then when I was getting my things together, the Asian nurse, the one that kept on telling me to take the medication, I'd be out in no time, said to me, "Miss Graham, you haven't seen Dr. Saunders. You need to come back at 5 o'clock to pick up prescriptions for medication."
So did you go back for your medication at 5 o'clock?
Yes, I did. I drove back. and I didn't realise that I shouldn't have drove. And when I was in the car, all the shops that were outside in the street, I felt like I was mentally transported back to 20 years ago.
Why? What happened?
Well, all the shops looked like there were shops in Leeds where I used to live 20 years ago, and I sort of looked at my sister was passenger, and I said to my sister, Wendy, I've lost it. I don't know where I am. I cannot see. You know, I've got no sense of direction. I just think I'm just about capable of driving, but I need to get out of the car. And she went, oh my God, Mary, we should never have come. And she couldn't drive either. So I just tried my hardest to stay focused on what I know on a driving level. And she did the directions, but not one street, or it was just trees and buildings, and they all were somewhere like, I thought I was somewhere 20 years ago in a different city altogether.
Right, so were you actually warned about driving with this medication?
No.
About what to drive on?
No. No.
Okay, thank you.
I stayed in my niece's flat. I never went out for a week, and I just basically withdrew from the medication, and I'd have to describe it that I was just very puddled. For the first 3 days I was habitually, if I went to wash my hands at the sink, I would think in her bathroom, I would think I was washing my hands in the Homerton Hospital. If I just was basically tripped back into a dimension of being in the hospital. I didn't know whether or not I got used to a habit of doing the same things on a daily basis, but I was certainly just puddled with the drugs, thinking all these weird things, that someone was coming to pinch my things, and just weird. I was just deluded, tell you the truth, really, coming off them.
Okay, thank you. So Mary, from all your experience that you've had, have you ever received any advice or warning about the medications that you were given from the mental health services, mainly from the Homerton Hospital?
No, not at all.
No advice, no warnings about side effects?
Nothing.
Any reasons why you were given the drug?
Nothing.
From all this experience, going back to the time when you went to your doctor because you'd been assaulted, have you ever, by anybody, been given a thorough medical examination?
No, not at all. Not at all.